Hello everyone, my name is Jazmin Calvo and I am here to present our study Exome Sequencing in Pediatric Acute Lymphoblastic Leukemia, Genetic Insights from Somatic and Germline Samples of Patients from Medellín Hospitals. This research was conducted in collaboration with the Genética Médica Research Group at Universidad de Antioquia, SynLab, and Hemato-Oncology Department at Hospitales San Vicente Fundación and Pablo Tobón Uribe. Acute lymphoblastic leukemia, or ALL, is the most common type of cancer in children, accounting for about 25% of all pediatric cancers globally. The incidence rates of ALL is around 1 to 4 per 100,000 people per year, with the highest rates occurring in children under 5 years old. While survival rates in developed countries exceed 90% due to advanced treatments, significant challenges remain in other regions. The incidence of ALL is notably higher among Hispanic and Latino populations, with these groups experiencing disproportionately poorer outcomes. In Colombia, the incidence of ALL is rising and many children face limited access to timely, advanced treatment options. Our study addresses these challenges by analyzing the genetic profiles of Colombian pediatric patients with ALL to improve diagnostic precision and guide more customized treatment approaches. The main aim of this study is to characterize somatic and germline genetic variants in Colombian pediatric patients with ALL. By identifying these variants, we aim to support personalized and precise therapies that address specific genetic risk factors found in our population. As a methodology, we conducted a prospective descriptive study recruiting 40 newly diagnosed pediatric ALL patients from two hospitals in Medellín. Clinical and sociodemographic data were collected include age, socioeconomic status, white blood cell count, risk stratification, and leukemia subtype. For genetic analysis, samples were collected from bone marrow and buccal swabs, then sent to a genomic diagnostic company where whole exome sequencing, or WES, was performed. WES focuses on sequencing protein coding regions of the genome, known as exons, which represents about 1 to 2% of the genome but contain most disease-causing variants. After sequencing, data was processed with the NF-core SAREC bioinformatic pipeline, enabled the identification of key somatic and germline variants relevant to our study aim of improving diagnostic precision and treatment approaches. As result and discussion among our 40 patients, the median age was 7 years with 59% male. The most common leukemia type was B-cell ALL, accounting for 88% of cases, and the most frequently observed risk level was intermediate, largely due to the age of the majority of our patients. Cytogenetic alterations identified include hyperdiploidy and hypodiploidy karyotypes, along with key translocations that impact both prognosis and clinical outcomes. For example, translocation to chromosome 9 and chromosome 22, known as the Philadelphia chromosome, is associated with more aggressive disease and indicates high risk classification. It fuses BCR and ABL1 genes, creating a tyrosine kinase protein that drives uncontrolled cell division. The translocation to chromosome 9 and chromosome 11 involving the KMT2A gene is often found in pediatric ALL and infant leukemia. It correlates with a poorer prognosis, early relapse, and chemoresistances, highlighting the importance of identifying this variant early to adjust treatment approaches. Finally, the translocation to chromosome 1 and chromosome 19 involves the TCF3 and PBX1 genes, is common in B-cell ALL, considered intermediate risk. It has implications for relapse, necessitating close monitoring to reduce recurrent risk. We identify pathogenic somatic variants such as KRAS and NRAS involved in RAS pathway, which regulates cell growth and proliferation. Variants here are linked to relapse and poor prognosis, especially in aggressive ALL subtypes. RUNX1, another key gene, is essential for blood cell development. Variants in RUNX1 disrupt hematopoiesis, increasing leukemia progression risk. Additionally, the ITGBL1 variant associated with cellular migration suggests an aggressive phenotype and correlates with poor prognosis. In the germline, we detect ABCB8 and PGM2 variants, both linked to chemotherapy resistance and metabolic adaptations. ABCB8 contributes to multi-drug resistance, potentially impacting chemotherapy effectiveness for ALL patients. These findings align with our study's aim, supporting more individualized and effective treatment strategies. As a conclusion, our study underscores the importance of genomic profiling in Colombian ALL patients to support personalized therapies. Identify clinically significant somatic and germline variants provides valuable insights, guiding more precise treatments and improving outcomes. By further exploring these genetic factors, we can better address the specific risk factors in our population. We extend our thanks to the patients and their familiars who donated the samples, to SINLA for their financial support, to the medical staff of San Vicente Fundación and Pablo Tobón Uribe Hospitals, to Patologías Tropicales Corporation at Universidad de Antioquia, and thank you for your time. I'm happy to answer any question about our research.